I'm Noel Aisu, and I'm an attendant to Mr. Livingstone Muhimbize. We are from Uganda. We learned about this place, this very important hospital, from a brother again who was here, who had almost a similar problem like he had, that is cancer of the esophagus. He came over here and he was handled very well. He had a very good testimony that he gave us that convinced us that this is the right place to come. So when he had some challenges that he felt in himself, he was taken to our hospital, that's Mulago National Hospital in Uganda, where of course they did some checks here and there and was discovered to be having the first stage of esophageal cancer. Now the challenge was, where do we go? Do we have it here in our country or should we go over? Of course, there were hopes of being there. There were questions of where do we get money, which is this hospital. The first thought was possibly let's try it here. But we said no, I think it's better to go where the brother was, who actually had very good treatment. And the whole family accepted that that was the best. Others had thought of going to Kenya, but still the whole move came to Uganda, to India.
Mr. Livingstone approached us through an email from Uganda with the complaints of difficulty in swallowing, and he sent some of his records like endoscopy, which showed that it is a esophageal cancer in the middle or lower esophagus. So we asked them to come over here. So once he came here, we evaluated him. A PET CT scan was performed which showed the disease is locally advanced in the lower esophagus. And since he was unable to eat anything, we initially tried to pass a tube to feed, but it was not negotiable. So when the disease was suggestive locally advanced in lower esophagus, we initially planned for a multidisciplinary meeting with medical oncologists and radiation oncologists to plan a multimodality therapy, where we give chemotherapy and radiotherapy in combination to reduce the size of the disease so that surgery becomes easy and it gives long-term outcome and better cure. So the patient received chemotherapy and in combination with radiotherapy for about 5 weeks, and during this phase he was thoroughly with us in touch in terms of nutritional prehabilitation, exercise and all, so that he tolerates all these treatment well. Once it was completed, after 4 weeks we repeated a scan, PET CT scan, which showed a good response, and after 2 weeks of waiting, generally we wait 6 to 8 weeks after completion of chemoradiotherapy, he underwent surgery where we removed the esophagus bearing the tumor and we took the stomach as a new pipe and joined it in the neck.
Now we had to be directed to the department. That department was so welcoming, and we guided by the coordinators. I thank the hospital for having the provision of the coordinators for especially us international patients. Very wonderful initiative. So those ones now took us to the right hospital. However, before we came, we were directed to a particular doctor here. And when we arrived, we were handed over to Dr. Azhar. Very welcoming person. He took everything so easy, and he made very nice, interesting statements. Sometimes he could say, when Livingstone would say, I have the pain, he would say, yes, with the doctors, our work is to give you pain, but eventually get you out of pain. Laughing and joking, patting us as a friend. And so the first time we were admitted, that was the time when he had a problem, the week of his operation. So it was a bit challenging to us. First we were told, organize yourselves. Said, yeah, that's okay. Then after some time, said, the doctor is not there. It might not be very possible. So we sank down, said, but how? What can we do next? But because of teamwork in the hospital, I think they went and shared it within themselves, came back to us. I love the teamwork. I love how they move as a team, supporting one another. So they arrived in our room and humbly sat to us and said, can we try to explain ourselves to you again? I think the operation is going to be done. We said, wonderful, we shall do it. So he was taken for that operation. When he was taken, I think what they noticed was that after checking through, the cancer had not, the tumor had not contracted. So I was called. Of course, I didn't imagine I would be called to a theater, but I had to be called there. Of course, I thought it was just merely walking through. I was stopped and I had to put on some very interesting shoes to cover my own shoes for my own safety. So the doctors came and explained to me, said, yes, we have done. They were very objective, but we have not done it exhaustively. We feel you should first go through the therapies, radiotherapy, and explained to me why it was necessary. It was technically explained. I understood it. I said, we're willing to stay. So the question was, can you go back and have it done and then come back? We said, no. We have come here. If it means being half citizens, we are set to remain here and make sure that everything is done. So the therapy started. I was so grateful that the way it was handled, there were a lot of scares, of course. Others saying, I think it's going to be very weak. I think, but a lot of encouragement was given. Every office, every doctor that we reached had a smile on their face. And you know, if smile is first treatment to a patient, it's a first treatment. And that is what I have seen in this hospital. Almost everywhere, there is a smile. Right from the entry there, you can't expect, you wouldn't expect to have a smile from an askari, but even an askari can give you a smile, which was hope to us. So we held ourselves with prayer and went through he had to undergo both chemotherapy and radiotherapy. And in each of those areas, the doctors we interacted with were so loving, so lovely and so encouraging. Whenever I had challenges, we would say, now there is this again. It's a normal thing. But one very good thing about this hospital is that you are told in advance what will happen. You are briefed that if, as you are going to go through this is what's going to happen. So of course, as my patient here, when things would happen, I would tell him that, you know, we were told that it is going to happen. Now, if it is happening, then it means we are getting treatment. Because if you are not going to show those things that we were told were going to happen, then we would begin to doubt the treatment. But since the doctors told us there will be this, nausea will be there. So we would complain, nausea, said, hey, that is normal. That is what the doctors told us. So that transparency gives hope. And I loved it of most of the doctors as they came. Even as it was a radiotherapy, he would bring a complaint. I'm feeling heat, I'm feeling pain. See, it is what happens. So we loved the whole thing. We had the chemotherapy, very loving and committed staff. Those young ladies, the nurses, I loved them. Interactive. Of course, there were challenges of the language, but we could understand ourselves. It was aided more by the signs. When signs come, I read also the signs and I can be able to interpret what it was. We're so grateful that even at that time of the therapies, we were given how to treat ourselves. We were guided. And we ever told, whenever there was a problem you had, say, no, try this treatment. They would prescribe, and then we were able to get that treatment. And so there was a time, of course, where the cells were somehow dropping. But still, with the technology that is there, they were able to to work it up, and we went through it successfully. After that, doctor said, I've done my part. Now back to Dr. Azhar. We had now to go to Dr. Azhar, who welcomed us. He said, this is our part. And I said, we have come and we trust that you will help us. He said, don't trust me, trust the other one above. And I think that is something that gave us even more strength, being people who believe in that one. He said, well, there are two things. You can either believe on the created or on the creator. We said we believe in the creator. And so all went on very well. He comforted us. He said, you will be okay. I'm going to be with you. We shall remove that sickness. Don't be worried. You have spent your time here, and I want to do you the best so that it is not a waste of time you're coming this way. So there we were. We were given more days to rest. I mean, as we wait on monitoring. But even at that time, we could still reach the doctors. We could still interact with them, and they would still be willing to help us. Of course, our fear was, how do you talk to a doctor? Maybe you must pay for every talk to a doctor. But Dr. Azhar, even as he would be moving, I would just say, doctor, doctor, doctor. And he would stop and say, now I have this problem. When do I talk to you? I said, even now, come and meet me. That kind of laxity, that kind of adjustability amongst the doctor, I felt it was really something very commendable that I loved in this hospital. The other thing then, of course, we came, we were admitted. The admission was well arranged. There was no stress. You just find things have been sorted out. I could ask, but where am I going? I said, just go, everything is sorted out. So we came, got admission, and he was now taken for the surgery. Which surgery, I have the confidence that it has been done well. I have that confidence because the results already I'm seeing in him gives me hope, and everybody who has heard about it gives the hope. The other thing that I'm very grateful about, still as I have to say, is that the doctors are ready to give any advice to a patient, which sometimes can be challenging in other places. But here, you are given that treatment. And as they come, I love the way they come to check on the patients. I love the system of the handover that is going on in the place here. The commitment of the staff, everybody is committed. I just say, I wish other places could also be like this. But we are grateful for the service we have given here, and that is why we have accepted to stay up to the end. We want to go when we are okay. The other final thing I finally say is that this place, the fear that people normally have with these international hospitals is the cost. But from what I have learned, the service that has been given to us cannot be compared to the cost that the payment we have been requested to pay. It can't. What we have paid, the treatment we are getting is more than that. That is my objective assessment. And so people should not fear coming to this hospital, saying the international hospital, how will I manage this hospital? Where will I get the money? You will never get enough money. But whatever you can get and you come over, the administration, the management will always be willing to talk and will be willing to give the right service, which will not make one regret. So I think that is basically what I can say. But I want to say we are going to talk much about this place. I have been wishing and sharing with him how best can we say thank you to this hospital. How? What strategies, what structures do they have in place? But I'm grateful that this is one of the structures. But I also try to say something here and there. I'm grateful, thank you.
Surgery went well. This surgery lasted close to about 4 to 4.5 hours. We kept the patient in ICU for 1 day. Total stay in the hospital was 7 days. We start oral diet on day 1. By day 3 and day 4, he was taking full liquid diets. At the day when he was discharged, he was eating normal diet. He was not having any tube. He was walking around and he was happy. Thank you.